Have you ever wondered why some people constantly feel anxious, even when there's nothing to worry about? Welcome to the complex world of anxiety disorders. A prevalent issue in today's fast-paced society, these disorders are more than just an occasional worry or fear. They're persistent, often debilitating conditions that can significantly affect a person's life. Understanding these disorders is crucial not only for those affected but for all of us, as it fosters empathy and helps reduce stigma. In this video, we'll delve into the 5 most common types of anxiety disorders. First on our list is generalized anxiety disorder, often abbreviated as GAD. This disorder is characterized by a constant state of worry, a feeling that's more intense than the normal anxiety most people experience in their day-to-day lives. Imagine a relentless hum of unease, a persistent sense of dread that disaster might strike at any time. That's what living with GAD can feel like. People with GAD often find themselves incessantly restless, their minds filled with worry about a wide range of things, from health and work to finances and family. It's not uncommon for them to spend hours ruminating over what-ifs and worst-case scenarios. This relentless worrying can make concentrating on tasks at hand incredibly difficult, often leading to procrastination or incomplete tasks. A key characteristic of GAD is the inability to control these feelings of anxiety. It's as if a worry switch has been left permanently on, and no matter how hard they try, individuals with GAD cannot seem to turn it off. It's important to note that this isn't a fleeting feeling of anxiety that comes and goes. It's a chronic condition that persists for months and in some cases even years. GAD, therefore, is not merely feeling anxious. It's a chronic condition that can significantly impair daily functioning. It's a serious mental health issue that requires understanding, empathy, and professional treatment to manage effectively. Scene script. Next up is panic disorder, a condition marked by recurrent panic attacks. Imagine a sudden wave of intense fear gripping you out of nowhere. Your heart starts to pound like a drum, echoing in your chest. Sweat beads up on your skin and your body trembles as though caught in an invisible storm. You can't seem to catch your breath, and a sense of impending doom looms over you. It feels as if you're losing control, or worse, that you might be dying. This is what a panic attack can feel like. Now imagine living every day in fear of experiencing this again. That's the reality for those living with panic disorder. The terror isn't just about surviving a panic attack, it's the constant dread of when the next one will strike, turning ordinary days into a series of potential minefields. This fear can be so potent that it dictates the individual's actions, leading to avoidance behaviors. They may start to steer clear of places, situations, or even people that they associate with past attacks. The world starts to shrink around them as they trade their freedom for the illusion of safety. But remember, panic disorder is a medical condition. It's not a sign of weakness nor a character flaw. It's a tangible, treatable disorder that millions around the world grapple with every day. Panic disorder can be debilitating, and the fear of future attacks can lead to avoidance behaviors. Moving on to social anxiety disorder, or SAD. This condition is characterized by an intense fear of social situations where an individual might be judged, scrutinized, or embarrassed. It's like standing on a stage, perpetually under an imaginary spotlight that turns benign gatherings into high-stakes performances. Individuals with social anxiety disorder often worry about acting or appearing visibly anxious, which may lead to blushing, trembling, or stumbling over words. They fear being humiliated, embarrassed, or judged by others. This fear isn't fleeting or occasional, it's a persistent dread that looms over their everyday life. This intense anxiety can lead to avoidance of social situations, from passing up opportunities to meet new people to declining invitations to parties or public events. Some may even go to lengths to avoid common social interactions like eating or drinking in public. Being alone in a crowd, that's how many describe living with SAD. It's not just about wanting to be alone, but about feeling isolated even when surrounded by others, because the fear of social interaction creates a self-imposed barrier. But it's crucial to remember that social anxiety disorder is not synonymous with shyness. Shyness can be a personality trait, but SAD is a prevailing fear that can significantly limit a person's ability to engage in and enjoy everyday social interactions. It's a debilitating condition that can impede one's social life, work, school, and relationships. SAD is not just about being shy, it's a persistent fear that can limit one's ability to engage in everyday social interactions. Let's talk about specific phobias now. Picture this: a tiny, eight-legged creature scurrying across a wall and you're frozen in fear. Or imagine standing on the edge of a tall building, your heart pounding like a drum. Maybe even the thought of boarding a plane makes you break out in a cold sweat. These are all examples of specific phobias. Specific phobias are characterized by an intense, irrational fear of a particular object or situation. This could be anything from spiders to heights, flying, or even certain types of food. People with specific phobias experience such an extreme level of fear that they will go to great lengths to avoid the object or situation that triggers their anxiety. Now, you might be thinking, well, I don't like spiders or heights either. But it's important to understand that the fear experienced by someone with a specific phobia is much more intense. It's not just a case of dislike or discomfort. It's a fear so overwhelming that it can cause panic attacks and severely interfere with a person's daily life. The fear is often recognized by the person as being irrational, but this doesn't make it any less real or distressing. It's like being trapped in a horror movie that only you can see and it's playing on a loop. Specific phobias can cause significant distress and may limit a person's activities and life choices. To sum up, these 5 types of anxiety disorders: generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias, are more than just feeling anxious or scared. They are serious mental health conditions that can greatly impact a person's life. Recall that generalized anxiety disorder, or GAD, is characterized by chronic and excessive worry. It's like an ongoing mental storm where the sun rarely shines through. Panic disorder manifests as sudden, intense bouts of fear, often accompanied by physical symptoms like chest pain or rapid heartbeat. It's like an unexpected hurricane, causing havoc without any warning. Social anxiety disorder, or SAD, is not simply about being shy. It's about an intense fear of social criticism that can lead to avoidance of social situations altogether. Imagine being trapped in an invisible bubble that separates you from the rest of the world. Specific phobias are intense, irrational fears of specific things or situations. It's like being in a room with an open door, but a large, menacing spider is blocking the way out. Each of these disorders can be debilitating without proper treatment. They can hold individuals back from living their lives to the fullest. But with the right help and support, it is possible to manage these conditions and lead a fulfilling life. Remember, understanding and empathy are key in supporting those who are battling these disorders. You never know whose life you might be touching with your kindness and understanding.